Um, Dr. Ray, just one of the questions I want to begin with is the narrative we've been hearing from a lot of young people who have been disregarding the importance of staying at home. And they've been saying that this disease is for the elderly. Let's try to highlight why it's important to remember the value that our elders, that our elderly community plays in societies all around the world.
I think it's a few things, and this is such an important point. First, if individuals go off, like what's happening in the United States, and they go off for spring break, and then they come back home and they are quarantined, they are oftentimes going around their parents and grandparents, exposing the very people who we want to try to protect. And in that exposure, even though you might have a 21-year-old who may not get as sick as someone who is, say, 61, that 21-year-old can then pass the coronavirus to that 61-year-old. So we want to be very mindful of that. I think that dynamic is something that has eluded us. As universities have shut down, essentially, and then sent children away, they are going home to the very people who we want to protect. I think the second thing is there's recent information come out about more demographics on age. And one of the big things we're seeing is that people who are in the range of like 25 to 55 are some of individuals who are some of the most people to end up getting the virus. So maybe that doesn't necessarily mean impacting the mortality rate, but they are contracting the virus. And people who have underlying health conditions, at times, underlying health conditions that they don't even realize they have yet, can be susceptible to this. I think the third thing is we really don't know the long-term health ramifications of the coronavirus. There's a lot of evidence coming out of Asia, coming out of Europe about the impact that the coronavirus has on people's lungs. This is why in the United States, we are having a lot of controversy around getting different types of medical equipment in and sharing medical equipment. And so those types of things are key. I think those 3 points for younger people really, really need to hit home to make sure that we protect the people who we really care about.